72 participants, comprising lab personnel, clinicians, livestock officers, and private service providers from Western 1 and 2, concluded the 5-day training on genome sequencing to strengthen disease detection and control in the Gambia. Officials also launched the sample referral network for Brikama, Bundum Maternal Clinic, and Kanifing General Hospital. A referral system mechanism enables a patient's health need to be comprehensively managed using resources beyond those available at their primary care location. In his opening remarks, the Deputy Director of the National Public Health Laboratory, Bakari Sane, said the system is now able to carry out all types of samples compared to the past when it was only capable of few tests such as HIV.
And then after the pilot, today is another journey. Now, as we speak now, more than 5,000 samples have been moved, and close to 30 hubs are where our SRN moves now, more than 30 sites. And only 4 hubs are moving, and then that pilot has really spoken volumes. And now close to more than 21 different types of samples are moving. But Papa and Aliu have already given you history of what is happening. Initially, the thinking was HIV, malaria, and HIV, maybe HIV and TB were the samples. But now the system has evolved to carrying all types of samples.
Baba Jame, a coordinator at the National AIDS Secretariat, elaborated on the importance of the SRM scheme, stating that it will promote accountability and make their work more effective and accessible.
The SRM is looking at all this. It is not saying HIV, we are looking at, initially, as a program, the HIV, they were looking at our samples. TB are looking at their samples. Malaria, all the programs are looking at as a parallel program. But we say, no, let us do it together. This is going to save us a lot of cost. Now, doing it together, the samples that you are bringing, you are not saying we are bringing only HIV samples. We are not saying every sample that is there is going to be transported. It's going to be on the day. So what we are doing is trying to integrate to make sure that we work together rather than working as individuals.
The Director of Public Health and Laboratories, Sirifo Jain, said SRN has employed 20 motorcycle riders for their services.
The SRN works on 3 things: on accuracy, reliability, and timeliness. This is our aim, and these are our objectives that we operate on. That is, to collect all samples on timely, to give our results on timely, and to make sure that the samples that are transported, they are monitored from the point that they are transported to the point where they are received, so that we get that reliability of the samples moving from one facility to the other. And then the conditions of the samples so that they are improved, so that we get accurate results from the tests that we perform.
Regional Health Director for Western 1, Musa Kamara, hailed NPLH for taking the lead, urging participants to make best use of the training.
I want to remind all of us here that the ECOWAS Code of Ethics for Health Professionals, although it is talking about health professionals, but it cuts across all sectors of development, including the military, including the other security outfits. It applies across, and that is Section 5, Article 5, Article 7, and Article 12. What have they said in these articles? Article 5 is articulating that all health professionals need to refrain themselves from any form of comportment that will discredit your institution. We need to be mindful of that. So this is why I said when it comes to sustainability plan, we need to put all factors in place so that we are mindful of anything that will discredit our institution.
Sample referral networks ease patient struggle, saving traveling time for testing, which makes outcomes more timely and accurate. Awa Manneh, GRTS News.